Rose Villamor.
Good morning, everyone. I am Roslyn Centino, one of the reporter of Group 5.
Good morning, everyone. My name is Rosal Pelotos, and I'm one of the reporter of Group 5.
Good day, everyone. This is Jackie De Gia speaking, a second-year student of Bachelor of Secondary Education, major in Values Education.
Hubert L. Repisada.
And we were going to discuss the topic 3, which is learners with difficulty moving and walking. All children learn best in a developmentally appropriate program that offers them the supports they need to participate successfully alongside their classmates. Many children with disabilities benefit from simple accommodations and modifications, while other children may need more specialized and individualized supports provided by special education professionals. Every child is unique, and every child can learn, look beyond a child's disability or label, and get to know him or her more as a person. We classified into 3 terms the learners with disability in moving and walking, and those 3 terms were physical disabilities, health impairments, and severe disabilities. And these 3 terms greatly affects the learners having difficulties in moving and walking. On the other hand, learners with disabilities moving and walking is also defined as impairment in mobility. Mobility impairment refers to the inability of a person to use one or more of his or her extremities, or a lack of strength to walk, grasp, or lift objects. The use of a wheelchair, crutches, or a walker may be utilized to aid in mobility. Mobility impairment may be caused by a number of factors such as disease, an accident, or a congenital disorder, and may be the result from neuromuscular and orthopedic impairments. Mobility impairment is also defined as a category of disability that includes people with varying types of disabilities. That is why we need to study these muscular and skeletal systems, the physical disabilities, the health impairments and severe disabilities, and many more that is included in this topic, because it is all connected while learners having difficulty in moving and walking.
Let's hit this. At the end of the chapter, the student should be able to first, define, compare, and contrast the terms physical disabilities, health impairments, and severe disabilities. Second, describe the skeletal and the muscle system of the human body. Third, define and differentiate orthopedic and neurological impairments. Fourth, enumerate and describe the types and classification of physical disabilities. Fifth, identify and discuss chronic illnesses and health-related conditions. And the last one, enumerate and describe the educational programs and support services for students with physical disabilities, health impairments, and severe disabilities.
Before we go deeper into the discussion, let us first watch this short film entitled Cuerdas, a Spanish word which means strings, in the YouTube channel of Cuerdas Cortometraje, or short rope. It is actually a 10 minutes video with an English subtitle in it. But later on, we will going to realize how beautiful the message of the video is trying to say.
Aquí te lo dejo. Ya sé que no es el sitio más adecuado para él, pero mira, es que estamos saturados. En cuanto podamos, nos lo llevamos a un sitio más acorde con su situación. Aquí tienes los informes, las medicinas. Esta es la última valoración. Y en esta maleta están todas sus pertenencias.
De acuerdo, firma aquí y ya está todo. María, ¿otra vez por los pasillos? ¿Quieres hacer el favor de salir al recreo con los demás niños? ¡Niños! ¡Niños! Este es vuestro nuevo compañero. Como veis, es un poco especial. Pero entre todos tenemos que conseguir que se sienta a gusto el tiempo que esté entre nosotros, ¿de acuerdo? Bueno, vamos a empezar con la clase. ¿Recordáis que ayer hablábamos de la importancia de las comas? Las comas pueden cambiar el sentido de una frase hasta convertirla en otra completamente diferente. Aquí por lo menos te dará el solecito un rato. Ahora vuelvo, ¿vale?
Pero María, ¿dónde vas?
Hola, ¿cómo te llamas? Yo me llamo María. Bienvenida al cole. ¿No sabes andar? Ni hablar. ¿No sabes nada? ¿Qué te pasa? Eres un poco raro. Mira, es muy fácil. Si quieres mover una mano, haces así. Y la mueves. Y si quieres hablar, haces así. Hola. Y lo haces.
María, ven a jugar con nosotras.
Y si te pica un brazo, ¿cómo te rascas? Yo cuando me pica un brazo no me puedo aguantar.
¡Jo, María! ¿Pero qué haces?
¿Quieres jugar conmigo a la comba? Mira, es muy divertido.
¡Qué rara es María!
Ya sé lo que te pasa. A ti lo que te gusta es el fútbol. Máxima concentración. El delantero va a chutar. Es el máximo goleador del campeonato. Pero la portera es la más chula de la competición. Impresionante patadón le ha dado al balón, que se acerca como una bala a la portería. Un niño en la silla de ruedas ha metido gol. ¡Gol!
¡Pero qué rara es María!
Señor, déjame a mí, que yo puedo.
Muy bien, de acuerdo.
Chocolate, choco chocolala, choco chocotete, chocolate, chocote, chocolate. Érase una vez una bruja enamorada de un príncipe. 1, 2, 1, 2, 1, 2. ¡Capitán! ¡Salve a la doncella! ¡Auxilio, capitán! ¡Solo vos podéis salvarme! No conseguiréis salvarla. La doncella está a buen recaudo. ¡Jo, jo, jo! El príncipe y la bruja fueron felices por siempre jamás. 1, 2, 3 al escondite inglés y mover las manos míos pies. 1, 2, 3 al escondite inglés y mover las manos míos pies. ¡Ah, te he pillado! Tú solito lo has conseguido. Vas a recuperarte y vas a andar y también hablar y vamos a viajar por todo el mundo. ¿Sabes que hay sitios donde comen hormigas? Bueno, no hace falta que comamos hormigas.
María, hoy no puedes salir al recreo. Mira, está muy cansadito. Si quieres, puedes quedarte aquí con él y le haces compañía.
¿Qué te pasa? ¿No te apetece jugar hoy?
podíamos imaginar que estuviera tan malito. Nunca se está preparada para algo así. Bueno, por lo menos ha sido por la noche y sin sufrir. La verdad es que su cara era de alegría. No sé cómo se lo vamos a decir a los niños. Sobre todo a María. Se había hecho muy amiga de él.
Ya lo sé. Recogeremos sus cosas lo antes posible. Siento que hayas tenido que pasar por este trance.
Buenos días, niños. Soy María, vuestra nueva profesora.
Now we have seen the video. It is so inspiring, right? Now, there are students in regular schools who walk with a limp as a result of poliomyelitis when they were young. Some students are crippled due to amputation of legs and arms as a result of diseases, fractures, and accidents. There are other diseases that affect the normal development and functions of the skeletons and muscles. Students with crippling conditions walk with crutches, braces, or move around in a wheelchair. Thus, children with physical disabilities are very visible in the school and the community as they ambulate with the use of assistive devices. There are also children who have cerebral palsy, a severe impairment that disables them to maintain normal posture and balance to perform movements and skills. In the case of children with epilepsy, they experience seizures that is caused by abnormal and excessive electronic discharges within the brain. Crippling conditions, cerebral palsy, and epilepsy are only few of the many physical disabilities, health impairments, and severe disabilities that children and youth suffer from. These disabilities restrict their movements and activities and their intellectual functioning as well. The children may have normal mental ability, but their conditions limit their participation in class activities. Thus, special education and inclusive education services are extended to them like the other categories of exceptionalities that were discussed earlier. Now we have idols, right? Idols, heroes, leaders, stars, whatever they are called. They are the people we look up to and emulate. Almost always, Filipinos have the tendency to put someone in a pedestal to serve as a guiding force in their day-to-day lives. We tend to put them above us to serve as an example or an inspiration so that we can follow their footsteps or perhaps copy what they have done in order to achieve something in their lives. For example, Apolinario Mabini, a sublime paralytic hero, or the so-called dakilang lumpo, or utak ng himagsikan, right? Apolinario Mabini was one of the best heroes who shaped Philippine history as the sublime paralytic, or the dakilang lumpo. He's one of the heroes who have been respected through the generations. In short, he was the epitome of a hero. Mabini can perhaps be credited for the way persons with disabilities are now slowly coming out of their shells. Slowly, they are showing us that they too have a role play in our society. Why? Maybe because they feel that if someone like Apolinario Mabini can lead a revolution and become a hero in spite of his disability, then they too can be a hero during their own time. Indeed, Apolinario Mabini has become the idol of many persons with disabilities. He has become a shining example for them to follow and emulate. Mabini indeed was worthy of recognition. His actions have shown that his disability was not a hindrance. He did not let it deter him from doing what he wanted to do, and that is to fight for the rights of the Filipino people. His shining example has caught the interest of many Filipino people, especially those with disabilities. His example shines as a beacon for many of us, a light in the midst of our despair, and he is our candle in the dark. He is just one of the example of the persons with disabilities that inspires us and motivates us, especially for those with impairments and disabilities. And now, let's proceed to our next discussion about human body's skeletal and muscle systems.
Call me wild, drinking up the sunshine, be my man.
My topic is about human body's skeleton and muscle system. Physical disabilities attack the body's skeletal and muscle system, the nervous system, the bones, joints, and limbs. A brief review of the normal skeletal and muscle systems provide the background for a better understanding of physical disabilities.
This is a human skeleton, just a model of human bones. Don't get scared. Let's learn about the skeletal system.
Let us discuss about the skeleton.
Every person has a skeleton built up of so many bones. These bones give your body structure, protect your internal organs, let you move, and much more.
The adult skeleton provides the body's internal scaffolding. It is made up of 206 bones and accounts for 1/5 of the body's total weight. There are 4 classes of bones, including long bones or limbs, short bones in the wrist and ankle, flat bones in the skull, irregular bones in the face, and vertebrae. The bones of the hands and feet constitute half the total number of the bones in the body. The 206 bones are found in the different parts of the body. Skull has 22 bones. Ears has 6 bones. Vertebrae has 24 bones. Sternum has 3 bones. Throat has 1 bone. Pectoral girdle has 4 bones. Hip bones has 2 bones. Arms has 60 bones. Legs has 58 bones. An adult spine consists of 26 bones called vertebrae. It is divided into 4 sections. First, the cervical vertebrae, the top 7 bones of the spine in the neck. Second is the thoracic vertebrae, the 12 vertebrae attached to the ribs. Third is lumbar vertebrae, the 5 vertebrae below the ribs. And the last one is sacrum and coccyx. The sacrum is made of 5 vertebrae and the coccyx is made up of 4. In adults, the vertebrae are fused together. The skeleton supports the body. It protects the internal organs and allows a wide variety of movement. Most bones are connected together by ligaments to form flexible joints. The skull is formed from 22 different bones. The bones that form the brain case, or also known as the cranium, are separate at birth but gradually fused together through childhood. The collarbone or the clavicle supports the upper arm and allows it to move in a range or of direction. The shoulder blade, the humerus, the ribs protect internal organs and the chest cavity. The breastbone or sternum is a bony plate that connects the ribs. The radius, the ulna. There are 8 wrist bones or carpals in each wrist. The metacarpal bones are the 5 long bones of the hand that lead to the fingers and thumb. The hip or ilium bones is the outer part of the pelvic girdle. The kneecap or patella is the small bone that sits inside the cord-like tendon joining the thigh and muscle. The thigh bone or femur is the longest and strongest bone in the body. The shin bone or tibia is the major load-bearing bone of the lower leg. The fibula is the smaller of the two lower leg bones. Cartilage is a type of connective tissue that forms shock-absorbing discs between vertebrae, gives elasticity and strength to the knee joint, and surrounds the end of every long bone where it meets the other bones to form a joint. It is also joins the ribs to the breastbone. The next to discuss is about the muscle.
Hey friends, as you can see, I was exercising to grow some muscles as it needs constant attention. But before you jump into the exercising zone and start working out, you need to learn about muscle, so zoom in!
Muscle controls movement throughout the body, including automatic actions such as heartbeat, movement of the gut, and blinking. Muscles makes up over half of the body's total weight. There are three kinds of muscles. First, strip muscle, so-called because of its striated appearance under the microscope, makes up the majority. It contracts in response to the message from the brain. Next is smooth muscle. It's not under conscious control. It controls the digestive, urinary, reproductive and circulatory system and such unconscious responses as adjusting the iris in the eye. And the last one is the cardiac muscle. It's found only in the heart and is unique in being able to contract rhythmically and continuously. Muscle produce movement by contracting and are arranged in opposing pairs or groups. To raise the forearm, the biceps at the front of the upper arm contract and shorten while the triceps at the back relax and lengthen. To lower the forearm, the actions of these muscles are reversed. The biceps are stronger than the triceps because raising the arm works against the pull of gravity. Trapezius is a large diamond-shaped muscle in the upper back. It holds the head straight and contracts to pull it backwards. Shoulder deltoid raises the arms outwards from the body. Triceps contract to strengthen the arm. Pectoral muscle, biceps, external obliques contract to twist the torso. Latissimus dorsi is the large back muscles that holds the body upright. Trunk deltoids contract to bend the body forward. Tight muscles, or the quadriceps, is the large muscle that pulls the lower leg forward when walking and holds the leg straight when standing. Gluteus maximus is the largest muscle in the body, located in the buttocks. Hamstring muscles contract to bend the leg at the knee. Calf muscle contracts to pull the heel upwards and lift the back of the foot off the ground. Achilles tendon is a tough cord that links the bottom of the calf muscle to the heel and pulls the heel upwards when the calf muscle contracts.
Call me wild, drinking up the sunshine, be my man.
I'm one of the reporter of Group 5 and I will be discussing to you the different types of physical disabilities. There are a lot of reasons why a person has physical disability, tulad na lamang ng severe accidents, brain injuries, or serious illness and hereditary or genetic disorders. It affects the bones and muscle systems and make mobility and manual dexterity difficult and impossible. It causes deformities and absence of body organs and systems necessary for mobility. And it affects the nervous systems, making mobility awkward and uncoordinate. In short, physical disabilities are certain types of dysfunctions and disturbance in the body, resulting into its malfunctioning. So let's proceed to the orthopedic and neurological impairments. So these orthopedic and neurological impairments usually cause during birth defects, and it affects child's educational performance. And orthopedic children usually suffer from impairments of their muscles, skeletal, or nervous systems that may interfere with their natural functioning. The two distinct and separate types of physical disabilities are orthopedic impairments and neurological impairments. which is the orthopedic impairment affects the bones, joints, limbs, and associated muscles of the skeletal system. Examples of orthopedic impairments are the first example of orthopedic impairment is the poliomyelitis, or also known as infantile paralysis. This impairment is caused of the poliovirus, an infectious disease, a muscle weakness resulting in a flaccid paralysis.
Polio is a contagious viral disease that can affect the nervous system. It used to be very common and caused severe illness all over the world. It mostly affects children 5 and under. That's why it's so good you're getting this polio vaccine booster today. Most cases of polio are actually quite mild and don't need any treatment. But in a few instances, it can cause paralysis, even death. Your grandmother knows a little something about that, unfortunately. Although polio is rare, it still exists today. Vaccination is the key to one day eradicating the world of polio forever.
The second is the osteomyelitis, or tuberculosis of the bones and spine. This is an infection of the bone, and this is the rare but serious condition.
Osteomyelitis can be thought of simply as a bone infection. Osteomyelitis occurs when microorganisms, usually bacteria, are able to grow in bone marrow. There are 2 ways that the microorganisms can be introduced into the bone. The first way is through an open wound. The open wound may occur with an injury, such as an open fracture. There are bacteria everywhere. If bone is exposed to dirt, water, or even air, microorganisms may seed to the bone, begin to grow, and cause an infection. Bone may also be exposed to microorganisms in open sores and overlying soft tissue infections. People with diabetes often have sores on their feet that can become infected. Orthopedic implants such as plates, screws, and knee replacement prostheses make good places for bacteria to grow. The second way that osteomyelitis occurs is when microorganisms travel through the blood until they are able to settle in the bone. This is known as hematogenous infection. Often, this occurs because bacteria from another infection in the body travel through the bloodstream to the bone. Whatever the cause and whatever the source, the infection can begin to eat away at the bone. This can result in pain, loss of function, a collection of pus known as an abscess, and dead bone.
And the third one is the bone fracture, or the breakage in the continuity of the bone results from falls and accidents. Next is the muscular dystrophy. It's a group of long-term diseases that progressively weakens, deteriorates, and wastes away the muscles of the body. The disease is usually fatal. The infant appears normal at the birth, and the muscles begin to weaken at age 2 to 6 years old.
Muscular dystrophies are a group of genetic diseases that cause progressive muscle weakness and loss of muscle mass. The most common form is called Duchenne muscular dystrophy. It's caused by a faulty gene that is not working to properly produce an essential protein called dystrophin. Proteins are molecules that play roles in the structure and function of our body's tissues. Dystrophin is key for how our muscles work. Since the dystrophin gene is carried on the X chromosome, Duchenne affects primarily boys. This means that females can be carriers, typically without symptoms, but can then pass it along to children. Symptoms of Duchenne can start as early as age 3, affecting muscles that move the hips, thighs, and shoulders. Muscle weakness gets worse with age, also affecting the heart and respiratory muscles, leading to life-threatening complications, including disease of the heart muscle and breathing difficulties. There is no known cure for Duchenne muscular dystrophy. Gene therapy aims to be a one-time treatment that may be able to slow the progression of Duchenne by introducing functional genes into cells to change how they operate. For instance, the gene would provide instructions to produce dystrophin. The working genes are delivered into the cells using a vector, which is often derived from viruses. Don't worry, all the viral genes are removed, and the vector is modified to only deliver therapeutic genes. The goal of the micro or mini genes is to improve muscle strength and integrity. However, these effects of gene therapy are still being researched. Other therapeutic approaches aim to prevent muscle weakness using different muscle proteins to compensate for the loss of dystrophin. There are even gene editing approaches being studied that would replace the dysfunctional gene within the muscle cells. Gene editing uses precise technology to make changes directly inside the cell. With any of these approaches, increasing functional dystrophin or other regulatory proteins can result in improved muscle function. researchers continue to work optimistically on gene therapies in clinical trials until they are safe and effective.
And another example of an orthopedic impairments is the Osteogenesis Imperfecta. This is a rare and inherited condition marked by extremely brittle bones, and the skeletal system does not grow normally, and the bones are easily fractured. As the child matures, the bones may become less brittle and require less attention. And the child with osteogenesis imperfecta is fragile and may be able to walk for short distances with the aid of braces, crutches, and other protective equipment. Children having this impairment have brittle bone and are prone to fracture, or also known as Lubistron syndrome. The term osteogenesis imperfecta means imperfect bone formation. Another example of orthopedic impairments is the limb deficiency. So this refers to the absence of or partial loss of an arm or leg. And the Greek word plegeia, which means to strike, is used in a combination with the affected limb, that is arm or leg, to describe the condition. So these are the examples of the limb deficiency. We have here quadriplegia, or all four quadri limbs, both arms and legs are affected. Movement of the trunk and face may also be impaired. Next is the paraplegia, and this is a motor impairment of the legs only. Hemiplegia, only one side of the body is affected. For example, the left arm and the left leg may be impaired. Diplegia, the major involvement of the legs with less severe involvement of the arms. Monoplegia, only one limb is affected. And the triplegia, 3 limbs are affected. And the double hemiplegia, the major involvement of the arms with less severe involvement of the legs. And the orthopedic and neurological impairments have close relationship. For example, a child who is unable to move his legs due to the damage in the central nervous system may also develop disorders in the bones and the muscles. An infant may be born with a congenital limb deficiency. Acquired limb deficiency results from the amputations of the arms or legs due to the diseases or accidents that requires surgery. A prosthesis or artificial limb is often used to replace the limbs, to facilitate balance, and to create a more normal appearance. Braces, crutches, and wheelchairs are used wherever applicable. And next is the crippling conditions that are congenital or present at birth.
This is cause of chromosomal aberrations, genetic mutations, congenital defects, or environmental factors.
So one of the examples of crippling conditions are the clubfoot. Clubfoot is the child is born with one or both feet deformed, usually with the feet and the toes turned inward, outward, or upward, often accompanied by winged toes. It is deformed foot which is twisted, or feet appear to be rotated internally at the ankle. And the second one is the club hand, the same as club foot, but this time the hands and fingers are deformed or twisted. So the next one is the polydactylism. The child is born with extra toes and extra fingers. So polydactylism, or also known as hyperdactyly, is an anomaly in humans and animals, resulting in supernumerary fingers and toes. Opposite ito ng oligodactyly, which is yung oligodactyly is fewer of fingers and fewer of toes. Kasi yung polydactylism is yung sobra-sobra yung fingers tsaka yung toes. Syndactylism naman, the fingers or toes or both are webbed like those fowls, ducks, and hens. So syndactylism is inheritable developmental defects. So this is characterized by complete or partial webbing of the fingers or toes. So there are two types of syndactylism. The complete syndactyly and the incomplete syndactyly. Halimbawa ng complete syndactyly, the both fingers are completely na magkadikit talaga. Tapos yung incomplete syndactyly naman, the end of the fingers magkadikit, pero yung sa dito niya, yung sa unahan, hindi, may pagitan kahit konti. Hindi totally full na magkadikit. So, that is called syndactylism. Let's proceed to the neurological impairment. This involves the nervous systems and affects the ability to move, use, feel, or control certain parts of the body. Some of the types of neurological impairment are described in the pages that follow. So, we have here the cerebral palsy. The cerebral palsy is characterized by disturbance of voluntary motor functions that may include paralysis, extreme weakness, lack of coordination, involuntary convulsions, and other motor disorders. It is a long-term condition resulting from a lesion to the brain or an abnormality of the brain growth. It can be treated but not cured. It is not fatal. The impairment does not get worse as the child ages. It is not contagious, and in the most cases, it is not inherited. The causes are varied and not clearly known. It has often been attributed to the occurrence of injuries, accidents, or illnesses that are prenatal or before birth, perinatal, at or near the time of the birth, or postnatal, soon after birth. So this cerebral palsy is the presence of causative lesions or damage to the brain that loss or impairment in the motor functioning. We have here the examples of cerebral palsy, the hypertonia, or commonly called the spasticity. This is characterized by tense, contracted muscles, and the movements may be jerky, exaggerated, and poorly coordinated, deformities of the spine, hip dislocations and contractions of the hand, elbow, foot, and this results in the inability to grasp objects with the fingers, and if able to walk, it may be with a scissors gait, standing on toes with knees bent and pointed inward. The next one is the hypotonia, or weak floppy muscles, particularly in the neck and trunk. The child with hypotonia has low level of the motor activity, slow to make balancing responses, and may not walk until 30 months of the age, or usually decrease the muscle tone. And the third one is the athetosis. It is a condition characterized by slow, worm-like, involuntary, uncontrollable, and purposely movements. A child with this condition may not be able to control the muscles of the tongue, throat, and may drool, so there is difficulty in expressive oral language. He or she seems to be stumble and lurch awkwardly when walking. At times, the muscles may be tense and rigid or loose, the flaccid, and has serious problem in the mobility and in doing activities of daily living. So, athetosis is the movements. Typical athetosis are sometimes called atheroid movements. The next one is called ataxia. It is a disturbance of balance and equilibrium resulting in a gait like that of a drunken person when walking and may fall easily if not supported. So this ataxia is degenerative disease of the nervous system, and its symptoms caused by damage to the cerebellum, part of the brain that is responsible for coordinating the movement. So the next one is the rigidity, and it is characterized by the marked resistance of the muscles to passive motion and display extreme stiffness in the affected limbs. So this rigidity is also called the increased muscle tone. The next one is the tremor. Tremor is marked by rhythmic and controllable movements of trembling of the body or limbs. It is the rhythmic shaking movement in one or more parts of your body. It is involuntary that you cannot control. Most often is in hands, but could also affect your arms, head, vocal cords, and legs. And the last example of cerebral palsy is the mixed type. This is characterized by the presence of traits mentioned in the preceding categories. So this mixed type cerebral palsy have damage to the motor control centers in several parts of the brain. Let's proceed to the Spina Bifida. Is a congenital defect in the vertebrae that encloses the spinal cord. As a result, a portion of the spinal cord and nerves that normally control muscles and feeling the lower part of the body fail to develop normally.
The term spina bifida comes from the Latin split spine, which is actually a pretty good description because spina bifida is a birth defect where the tissue on the left and the right side of the back that normally come over the spinal cord to protect it don't completely meet up to form a nice seal, leaving behind various degrees of an opening right down the middle of the lower back. Very early on in fetal development, the ectoderm, which is the outer layer of the fertilized egg, starts to develop a bit of a ridge that eventually becomes the neural tube. This neural tube goes on to become the spinal cord, the brain, as well as tissues that enclose and protect them, called the meninges. And spina bifida occurs when a portion of this neural tube fails to close properly, typically in the lower back. This constitutes a defect or absence of the vertebral arches due to a failure of mesoderm to organize over the region of the defect, and it may or may not involve the underlying meninges in neural tissue.
Children born with spina bifida develop hydrocephalus and the accumulations of cerebrospinal fluid in tissues surrounding the brain. This could lead to head enlargement and severe brain damage. And it is also known the split spine, and it occurs when mothers of the child have lacks of folate or folic acid during pregnancy. So the next one is the spinal cord injuries. The spinal cord injuries are results of accidents. Injury to the spinal column is generally described by letters and numbers indicating the site of the damage. For example, C5-6 means the damage has occurred at the level of the 5th and 6th cervical vertebrae. A flexible area of the neck susceptible to injury from whiplash and driving. In general, the paralysis and loss of sensation occur below the level of injury. The higher the injury on the spine, the more the injury or lesion cut through entire cord, the greater the paralysis. And the last one is the traumatic brain injury. So when we say traumatic brain injury, it is commonly caused by the injuries to the head, as results from automobile, motorcycle, and bicycle accidents, falls, assaults, gunshots, wounds, and child abuse.
Our son got hit in the football game and had to enter the concussion protocol. He was emotional, confused, and nauseous for a few weeks before he looked like himself again.
I hit my head on the sidewalk, but I don't remember falling. I remember being in the ambulance after, but that's all.
My fiancé was in an explosion in combat. When he returned, he had trouble finding words, organizing his thoughts, and paying attention to conversations. It was so hard for him.
I hit my head on a steel beam at work and it knocked me out. I had to stay home for 2 weeks. Lights and noise really bothered me, and I didn't feel well at all.
These are the voices of people who experienced a traumatic brain injury, and the voices of people who care about them. Traumatic brain injury, or TBI, is a common injury, and people can experience effects that last anywhere from a few hours to their entire lifetime. In some instances, TBI can be deadly. Knowing signs and symptoms of TBI and knowing when to call for help empowers family and friends to make a difference. TBI is caused by a blow to the head that causes the brain to have problems functioning. Many people experience bumps or jolts and don't end up with TBI. Brain injuries can be mild, moderate, or severe. The vast majority of TBIs are mild and are commonly known as concussions. Most people who suffer a concussion recover completely, although people are at risk for more problems if they hit their heads again, especially if they're still recovering from the first concussion. Any head injury can be dangerous, and getting medical attention is always encouraged. Definitely get emergency medical attention if someone is unconscious, confusioned, has seizures or slurred speech, if they keep vomiting, or if they feel numb or weak.
Children may also have difficulty in paying attention and may display inappropriate or exaggerated behavior, ranging from extreme aggressive to apathy. So that's all for my report. I hope that all of you understand and learn from my topic.
Call me while drinking up the sunshine. Be my man.
Good day, everyone. Learners with difficulty in moving or walking can be classified into three. This can be physical disability, health impairments, and severe disability. So today, I'm going to discuss about the health impairments. So what is this health impairments? So health impairments of children are due to chronic or acute health problems that adversely affect their educational performance. These problems are present over long periods and tend to get better or disappear. Children with these healthy problems are not usually confined in hospitals, except during attacks or flare-ups of their diseases. In many instances, health impairments could result to poor school performance and social acceptance, and their effects to the child is great. Hence, it is important for teachers to be aware of these problems. So, among the chronic illnesses and other health-related conditions are the following. First is asthma. Asthma is a chronic lung disease characterized by episodic bout of wheezing, coughing, and difficulty in breathing due to the inflammation of the airway in the lungs. It is usually triggered by allergens such as certain foods, spit, and pollens, irritants such as smog, cigarette smoke, and exercise or emotional stress. The severity of asthma varies greatly. The child may experience only a period of mild coughing or extreme difficulty in breathing that requires emergency treatment. Symptoms generally begin in early childhood but sometimes do not develop until late childhood or adolescence. Its symptoms might also appear following a viral infection of the respiratory system. So next is diabetes. Diabetes is a disorder of metabolism that affects the way the body absorbs and breaks down sugar and starches in food. Children with diabetes have insufficient insulin, a hormone normally produced by a pancreas necessary for proper metabolism and digestion of food. Early symptoms include thirst, headaches, weight loss despite of good appetite, frequent urination, and cuts that are slowly to heal. The child lacks energy, and important part of the body, particularly the eyes and the kidney, can be affected by untreated diabetes. So next is epilepsy. Epilepsy is a convulsive disorder commonly known as seizure, a disturbance of movement, sensation, behavior, and/or consciousness caused by abnormal electrical activity in the brain.
Hi, this is Elena. She loves to draw, play dress up with her friends, play with her dog, and oh yeah, she has epilepsy. Oh, what is epilepsy? Well, let's start with the brain. Your brain cells send electrical messages to your body to tell you to move, think, and do things. But when brain cells stop working the way they are supposed to and send too many electrical signals at one time, that's called a seizure. It's like a giant electrical storm. These seizures cause a change in how you see things, how you move, and what you feel. Epilepsy is when a person, like Elena, has one or more seizures over time. Her seizures only last a short while and can look different each time. Here's how it could look when someone is having a seizure. They might stare into space. They may look like they're chewing gum, but they're not. They might be fumbling as if they lost something. They could be wandering around like they are lost. Their whole body might shake. They might say things that don't make any sense.
There are several types of seizures, 3 of which are common. So first is generalized tonic-clonic seizure, formerly called grand mal, is the most suspicious and serious type. The affected child has little or no warning that the seizure is about to occur. The muscles become stiff, the child loses consciousness and falls to the floor. Then the entire body shakes violently as the muscles alternately contract and relax. Saliva may be forced out of the mouth, legs and arms may jerk, and the bladder and the bowels may be emptied. After about 2 to 5 minutes, the contractions diminish. The child either goes to sleep or regains consciousness in a confused or drowsy state. This type of seizure may occur as often as several times a day, or as seldom as once a year, and more likely to occur during the day than at night. So the next one is absent seizure, previously known as pitimal, is far less severe than the generalized tonic-clonic seizure, but may occur more frequently, as often as 100 times per day in some children. Usually, there is a brief loss of consciousness, lasting for a few seconds to half a minute. The child may stare blankly, flutter or blink her eyes, grow pale, or drop whatever he or she is holding. Teacher mistake him/her as daydreaming or not listening. The child may not be aware of the seizure and no special first aid is necessary. So lastly is partial seizure, which could be complex or simple. A complex partial seizure, also called psychomotor seizure, may be appear as a brief period of inappropriate or purposely activity. The child may smack his/her lips, walk around aimlessly, or shout. She may appear conscious but is not actually aware of the behavior. It could last from 2 to 5 minutes, after which the child has amnesia about the entire episode. The simple partial seizure is characterized by sudden jerking motions. With no lost consciousness, it may occur weekly, monthly, or only once or twice a year.
Now that you know what seizures look like, here's what you can do to help someone having a seizure. Stay calm and try to relax. If you have a watch or a phone, try to see how long the seizure lasts. If they fall on the ground, find something soft to rest the person's head on. This protects them from hurting themselves or others. Turn the person on one side so they don't choke. Tell other people around you that this person is having a seizure. Stay with the person until they feel better and ask how you can help. Continue to be calm and cool until the person can answer questions. Be a friend when the seizure is over. If you think you aren't big enough to help, go and find an adult. But wait! There are some things you should never do when someone is having a seizure. Never put anything in the person's mouth, even medicine. Never try to hold the person down. Never leave the person lying on their back. Never make fun of someone who just had a seizure. And remember, epilepsy is an electrical problem in the brain. You can't catch it like a cold, and it doesn't make people like Elena any different from you. Be sure not to make fun of someone with epilepsy. It's not nice, and it's definitely not cool. Having epilepsy is no different than anything else, and your friends shouldn't be treated any differently. If you see anyone being bullied or teased because of their epilepsy, or for any other reason, tell an adult. Always be there for your friend that's being bullied. And now you know all about epilepsy. Thanks to you, kids like Elena will be safer and happier. Let's all take care of each other. This is what being a good friend is all about.
So another chronic illnesses is the hemophilia. Hemophilia is a rare hereditary disorder in which the blood does not clot as quickly as it should.
So what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back.
So lastly are burns. Burn result from household accidents but sometimes caused by child abuse.
A nice mug of hot cocoa. Ooh dear. When you burn yourself, the extreme heat cooks your skin, damaging the top layer of skin cells. The damaged cells trigger an alarm inside your body and it sends in your immune system to clean up the mess. First, it flushes the area with a load of new blood full of white blood cells. This makes the burn site go hot and red. These white blood cells remove the damaged skin by easing it. Yummy. Then there's a rush of plasma. This creates a blister to protect the area. Meanwhile below, new skin cells are being born all the time, making their way to the top. So don't be tempted to pop that blister, as it's doing an important job protecting the new skin.
Oh, but it's so satisfying.
Yes, Sand, but you could get germs in there. Your body knows when the time is right to dry up the blister. Only when the brand new skin is ready.
Oh no. Be careful with hot drinks, unluckiest kid.
The disfigurement caused by several burns can affect a child's behavior and self-image. So here are the other health problems include a heart condition, leukemia or severe anemia, rheumatic fever, depresses, and lead poisoning.
Call me wild, drinking up the sunshine, be my man.
Severe and multiple disabilities. This category is children who exhibit 2 or more disabilities, with the exemption of the deaf-blind. Usually, the combination are mental retardation, learning disabilities, autism, Down syndrome, speech disorder, physical disabilities, visual and hearing impairments, emotional and behavioral disorders, and others. However, while they need intensive support for life, there are those who have average or above average intellectual abilities, giftedness, and talent.
Good morning, Glenn! Morning, teacher. Our activity for today is to place the spoon inside the box, like that. So, the first thing that you're going to do, reach the spoon and place it inside the box. Go. Reach? Yes. Go. I know you can do it, Blanc. Then, place it inside the box. Okay. Teacher will help. Okay, now stretch your arms. And place it inside the box. Perfectly. Okay. Come on. Wow, very good, Glam. Very good.
Call me wild, drinking up the sunshine, be my man.
Characteristics. The disabilities significantly affect the development of cognitive, social, emotional, and adaptive skills. Learning does not take place the way it does with the most children. The condition limits interaction with other children, adults, and restricts normal activities. They have difficulties with adaptive behavior and in coping with the natural and social demands of the environment. They may display age-inappropriate and socially unacceptable behavior brought about by the inability to recognize situations when and where certain acts may be improper and permissible. Examples are certain forms of antisocial behavior such as undressing in public, self-stimulatory behavior like touching parts of the body, self-injurious behavior like head-banging, poking the eyes, and self-mutilation. They may appear to be completely out of touch with reality and may not show normal human emotions. It may take some work and efforts to capture the child's attention to evoke any observable response. Many of these children need intensive and pervasive support under constant supervision since they are often unable to care for their basic needs, such as dressing, eating, toileting, and maintaining personal hygiene.
Call me while drinking up the sunshine. Be my man.
Prevalence and incidence trends. The 1997 UNICEF report on situation analysis of children and women in the Philippines, cited in the Chapter 2, indicates that 25.9% are without one or both arms or hands, while 16.4% are without one or both legs or feet in the projected 80 million population. No other local data on prevalence or incidence estimates are available for those with health impairments and severe or multiple disabilities. The special education enrollment data of school year 2004-2005 show that 10% of the students with disability have orthopedic impairments, while 2% are those with health problems. No enrollment data are available for children with severe disabilities. It is possible that these children may have been categorized according to their primary disabilities. The low participation rate of children with physical and health impairments could be due to the fact that these children are enrolled in regular classroom without the benefit of special education services. Hence, they are counted among the regular students. Others are out of school, unlocated, and unidentified due to the severity of this disability. The growing public awareness on disabilities has partly reduced the incidence of numerous childhood disease and disabilities. Some of the initiatives are the law on newborn screening that detects and treats congenital disabilities, prenatal care made available in government health centers, immunization programs, along with early intervention, physical therapy, medication, and the application of assistive technology.
Call me while drinking up the sunshine. Be my man.
Educational programs and services to children with physical disabilities, health impairments, and severe disabilities take into consideration both the administrative and instructional models of special education. There are 4 administrative models. First is the inclusion in the regular class. This setting advocates for inclusive education mainly through mainstreaming and full-time placement in regular classes. In this model, the special education teacher helps the regular teacher in dealing with the special needs of the children. Ideally, there should be an access to the services of an interdisciplinary team composed of physical therapists, occupational therapists, speech therapists, physicians, nurses and other specialists, psychologists, and guidance counselors. The amount of support that may be required by these children varies greatly according to the condition, needs, and level of functioning. Children with physical disabilities, health impairments, and severe disabilities who can develop their full potentials in this setting are those who have mild to moderate disabilities that are correctable with assistive devices, need for support is intermittent or periodic, have borderline or average mental ability, is low learner, or with mild mental retardation with mild learning disabilities, require only minor modifications in facilities such as ramps, altered seating arrangement, and simple assistive equipment like braces, crutches, and wheelchairs, and require no drastic curriculum revisions with respect to content, type of educational experiences, length of time spent in schooling, or ultimate goals.
Parents of those children with chronic illnesses who are often absent from school should be assisted to tutor their children at home if they cannot hire special tutors. This way, the children will be able to cope with the lessons discussed in class. An effective inclusive education program develops self-direction and independence as the students with disabilities attend to their schoolwork. Peer relationships and social development are enhanced by the cooperative class activities that allow the non-disabled students to recognize the abilities of their classmates with handicapping conditions. Research data show that with adequate support services and class modifications made available, attending the same school and participating in the same activities with their non-disabled classmates greatly contribute to the social development of these children. A special class. A special class is composed of children with disabilities who do not meet the criteria for inclusion in the regular class. While special education teachers handles the class, partial mainstreaming in regular classes may be worked out. There may be more than one grade level in a special class. The class may be located in the Special Education Center or Special Education Resource Room in the regular schools or special schools. Hospital-bound instruction. The special education program of the hospital admits children with physical disabilities or chronic illnesses who cannot study in regular schools. The National Orthopedic Hospital or NOH, located in Quezon City, has a school for crippled children that offers educational services from the elementary to the secondary level. The Philippine General Hospital in Manila has a ward known as Silahis ng Kalusugan that caters for children who are suffering from chronic illnesses and diseases. Homebound or home-based instruction. Children who have severe or multiple disabilities, mobility problems, or chronic illnesses are regularly visited by the itinerant special education teachers in their home who provide instruction based on their needs and capabilities. In case a SPED teacher is not available, the parents can provide direct instruction or hire a teacher to provide regular instruction. The knowledge and skills learned at home or in the hospital are accredited through the Philippine Educational Placement Test or PEPT of the Department of Education. Modifications and adaptations in the curriculum and strategies in teaching and evaluation of learning are introduced to suit the needs and conditions of children with physical disabilities, health impairments, and severe disabilities. Individualized Instruction Model. The Individualized Education Plan or IEP identifies the annual goals, short-term objectives, and weekly or daily instructional plans for specific children. Self-management skills are taught for self-regulation and competence in the adaptive skills. A structured curriculum is used, and the academic subjects are learned through diagnostic and prescriptive teaching, task analysis, close monitoring, and reinforcements through immediate feedback and mechanisms. Resource Room Model. Children who are mainstreamed in regular classes go to the resource room for special instruction, tutorial, and monitoring activities. Resource room is the repository for the instructional materials and references that the children use in doing their homework and projects to comply with the requirements in the regular class. Resource room is used for meetings with regular teachers, administrators, parents, and others. Non-disabled classmates go to the resource room to do work with the children with disabilities or simply socialize with each other. Curriculum Modification Model. Changes are introduced in the regular curriculum to accommodate special education needs of the children in a functional curriculum. The functional curriculum includes training on gross and fine motor skills, maximum use of vision, hearing, touch, and other working sensory modalities, receptive and expressive communication skills, functional academics, and social skills. Active rather than passive learning is employed. Instructional variations model. A variety of suitable and effective instructional approaches are employed. Choices of instructional strategies are based on successful previous preference of the students, motivation level, individual learning style, and learning rate.
Call me while drinking up the sunshine. Be my man.
The next to discuss is about educational support services. A student with physical disabilities, health impairments, and severe disabilities need the service of an interdisciplinary team composed of special and regular teachers and school administrators, parents, physical and occupational therapists, medical personnel, specialists, psychologists, and guidance counselor. The team addresses for the medical, educational, therapeutic, vocational, and social needs of the children.
Great job, Sophie.
Thanks, Mom. There's an awesome team helping me at my school, and they include education support professionals. Like, whenever I'm on the bus, Mr. Davis encourages me to read. Officer Rodriguez cares about me. He keeps me safe. Mrs. Jackson is our office superhero. No matter how busy she is, she's always there to help. If anything breaks, there's nothing Mr. Wong can't fix. And Nurse Stevenson makes sure everyone is healthy. Math used to be hard for me, but now with Mr. Rushi's help, it's my favorite class. Ms. Jones feeds us hot and healthy meals so we have energy to learn. The school is spotless thanks to Mr. Decker, and he also helps me with my 3 pointers. Swish! Mr. Lee fixes the computers at our school, but also takes time to help students in need.
Wow, it really takes a village to educate students.
Yep. And since they help us from preschool through college, I can count on them for years to come.
Education support professionals live in the communities where they work. They meet the needs of the whole student by keeping them healthy, safe, supported, engaged, and challenged.
Call me while drinking up the sunshine. Be my man.
The physical therapist is primarily concerned with the planning and implementation of the program to develop and maintain correct bodily posture and mobility. The program objective is to assist the child in the use of muscles and locomotor functions to reduce pain, discomfort, or long-term physical damage. The occupational therapist focuses on the child's participation in activities that are useful in self-care, communication, recreation, employment, and other daily living skills. A specific training is given to motor behaviors like drinking from a modified cup, buttoning clothes, tying shoes, for pouring liquids, and other adaptive skills. These activities enhance the child's physical development, independence, vocational potential, and self-concept. The speech therapist deals with the remediation of all forms of speech, voice, hearing, and language problems caused by physical, mental, or psychological disorders.
Physicians, nurses, and specialists appraise the current health status and the disability itself, provide treatment, and recommend therapy services when needed.
The prosthetist designs and fits artificial limbs. The orthotist designs and fits braces and other assistive devices. The biomedical engineer develops or adopts assistive technology. And the social worker assists students and families in their adjustment to the disabilities. The psychologist conducts psychodiagnostic and educational assessment for use as basis in school program planning and intervention. The guidance counselor offers the individual counseling, guidance service, and family therapy to those who need this service.
Call me while drinking up the sunshine. Be my man.
Within the regular school buildings, modifications have to be made in the learning environment to enable the students with physical disabilities and health impairments and those with severe disabilities to participate fully in the school and classroom activities. Environmental modifications may involve workspace modifications, changes in the location of materials and equipment. Object modifications are adapting the equipment or materials for the given tasks, changing the manner in which the task is done, and use of manipulation aids. The most visible type of environmental modifications is seen in buildings, offices, restaurants, hotels, and other service-oriented places that have been made accessible to persons with disabilities. Batas Pambansa bilang 344, otherwise known as the Accessibility Law enacted in 1983, and the Republic Act 7277, or the Magna Carta Act for Disabled Persons, direct schools and institutions to provide barrier-free architectures, which includes, but not limited to, sidewalks, ramps, handrails, parking spaces, toilet, and restroom facilities for persons with disabilities. The law provides that classes that have students with physical disabilities should be held in the ground floor as much as possible. Within the classroom, the problems of the students with physical disabilities may be solved by simple procedures that require little or no cost at all, like the following: modifying school furniture by changing desk or tabletops to appropriate heights for students who are very short or who use wheelchairs, adjusting seats to turn either side so that the children with braces can sit more easily, providing footrest, adding hinged extension to the desk with a cut-off for the child who has poor sitting balance, eliminating protruding parts over which the child might trip, providing need-based assistance like taping paper to the desk, devising some means or keeping pencils, crayons, and other materials from rolling on the floor, providing back racks or mechanical page turners, providing wooden pointer to indicate responses on the board, installing paper cup dispenser near water fountains for wheelchair users, and placing rubber mats over the slippery sections of the floor.
This is Donna and her 5-year-old daughter, Anne. Anne has autism and struggles with communication. Anne engages in a lot of behaviors to get Donna's attention. Donna tries to ignore Anne's attention-seeking behaviors, but Anne's behaviors escalate to something that Donna can't ignore. Donna has been working to help Anne learn some new ways to communicate, but she doesn't know how to change her behavior if she can't ignore it. Anne plays well with her toys, but only if Donna stays in the room with her. When Donna leaves the room to do something like answer the door or go to the bathroom, Anne engages in behaviors she knows will draw Donna back into the room, like throwing her toys. This is especially bad when Donna tucks her into bed at night. Donna can't ignore this. One of these days, Anne will throw a toy through the glass in her window, causing a potentially dangerous situation. Donna decides to try environmental modification. She reads online that this antecedent intervention helps reduce the opportunity for Anne to engage in the challenging behavior, while Donna works to teach her a more appropriate way to get attention. Donna is also working on teaching Anne to play alone for short periods of time. In looking at Anne's room where she plays, Donna realizes that there are a lot of things that Anne can throw. Donna decides to remove everything small enough for Anne to throw, except for a few small, soft toys. Donna knows that she will have to work to teach Anne not to throw the toys, but removing the toys gives her an immediate solution that gives her the opportunity to focus on teaching Anne the skills she needs.
Call me while drinking up the sunshine. Be my man.
So So, assistive technology. The United States Congress defines assistive technology as any item, piece of equipment, or product system, whether acquired commercially off the shelf, modified or customized, that is used to increase, maintain, or improve the functional capabilities of individuals with disabilities. Students use assistive technology so that they can access the same educational opportunities as their peers. So students with disabilities use either high technology assistive equipment or low technology adaptive devices or both.
This is Mai. Like every other morning, she's very excited to get ready to go to school with the rest of her friends. But getting to school is not always an easy task. Mai's wheelchair is supposed to help her be independent, but the only option available in the area was an indoor transport wheelchair. The unpaved roads, which get muddy after rain, are difficult to navigate with her ill-fitting indoor transport wheelchair, often forcing Mai to take a longer path to school. Using an improper wheelchair also affects Mai's posture, causing discomfort, pain, as well as stiffness in her muscles and joints, making daily activities increasingly challenging. Just like Mai, more than 1 billion people need assistive technology, but only 1 in 10 has access to the technology they need. And even when assistive products are available, they're often not the appropriate type or size, and quality is often very poor, which may cause more damage than good. To overcome this issue, UNICEF and the World Health Organization have partnered to bring appropriate assistive technology to persons living with disabilities. One key way is the development and distribution of the new WHO Assistive Product Specifications, the APS 26. The APS 26 defines the global specifications for assistive products and will help countries procure suitable, affordable, and good quality assistive technology products for whoever needs them. There are 26 assistive product specifications included within. The list of requirements will guide procurement and make sure no one must go through life with inadequate equipment. The APS 26 is a vital tool to increase independence and improve the participation of children and adults with disabilities by providing access to life-changing product. Assistive technology is key to unlocking opportunities for education, health, employment and social integration, and bridge the disparities for persons with and without disabilities. UNICEF and the World Health Organization are committed to putting quality assistive technology within reach of every person living with a disability. Their triumph is everyone's victory.
ATs can provide different kinds of support. For blind people, ATs are often based on tactile communication like Braille, or sounds to replace images, text-to-speech devices, or technology to assist mobility. For deaf people, ATs can increase the sound level, for instance by means of hearing aids, or replace the sound by images or vibration-like visual alerting devices. For ASD, ATs are often designed to overcome barriers in communication. Here, augmentative and alternative communication technologies have been developed, like speech-generating devices. ATs can be medical devices, but it is also possible to use mainstream technologies for assistive purposes. For example, GPS navigators with voice interfaces are often used by blind people, video phones for sign language users, and video games can be used by people with ASD to simulate and prepare for daily specific situations. Currently, people with disabilities face a wide range of barriers. These include, for instance, physical and communication barriers, but also social barriers. There are many expectations regarding the benefits for people with disabilities in society connected with the use of ATs, since they can support people with disabilities to overcome the challenges they face.
Users of assistive technology are cautioned to be informed when selecting these devices. There is a wealth of information that teachers and parents can access, thus allowing them to make informed choices about the products they want to purchase and the services they want to select. They can start reading general information on the subject from books and available publications. They can contact national and local agencies, institutions and disability organizations like the National Council for the Welfare of Disabled Person, the Department of Social Welfare and Development, the Department of Education, the National Orthopedic School for Crippled Children, Philippine National School for the Blind, Philippine School for the Deaf, Tahanang Walang Hagdan, Resources of the Blind, among others which can give them information they need. Local hospitals, community rehabilitation, or vocational centers may be active in designing and fitting assistive devices to complement the child's capabilities. Another local resource is Computer Users Group, which can provide valuable information about the use of software and hardware among the students with physical and severe disabilities.